Okay, so I'm washing my hands, and it's February 7th, 2021. The time is 20:30. Jake Nursing, January 1st, 1960, January 1st, 1960. Dr. Skills Lab. No known allergies, no known allergies. These are signed by the transcriber and nurse. The first medication is metoclopramide, due at 8 o'clock, so I won't be giving that one. The next one is dimenhydrinate, 150 milligram, 150 milligram. IM, daily at 2100, and it's 20:30 right now, so we're within the time frame. And it's for uncontrolled nausea secondary to chemotherapy. So I'm going to find my medication. This says dimenhydrinate. We're looking for 150 milligram, and it says 50 milligram per mil. So I should be able to get 150 milligram from this. And it has IM here, and that's the route I'm doing, so that's good. And it's not expired. So now I look at the monograph. It says the max daily dose for IM is 600, and we're at 150, so that's fine. The maximum single dose, however, is 100 milligram, and so we're over that. So I'd want to call the pharmacy and the doctor to make sure I can give 150 milligram IM. They said I can, and then the route here, it says IM administer undiluted. Then I want to take note of potential hazards and additional notes on here as well. Now I'm going to do some research. So dimenhydrinate, it's an anticholinergic, antihistamine, antiemetic, and it works by competing with histamine for H1 receptors, causing central anticholinergic activity, which results in a blockade of chemoreceptor trigger zone. It's indicated for motion sickness, nausea, vomiting, and vertigo. Contraindications are hypersensitivity, infants, neonates, tartrazine dye hypersensitivity. The usual dose is between 50 and 100, but I checked milligram, and 150 milligram is fine. If it should be given to a large muscle mass, it says, and I should aspirate if that's indicated at the site. Also want to check blood pressure and vital signs before giving this. Adverse effects are drowsiness, restlessness, a headache, hypertension, hypotension, and others. The peak is in 2 hours, and if it's given with alcohol or other CNS depressants, there's sedative effects, so I would want to not give it with those. Okay, so I'm going to calculate the dose that I need. So 150 milligram is X ml, and here it says 50 milligram in 1 ml. So then I get 3 mils, and then I write on here, Jake Nursing, dimenhydrinate, IM, the dose is 150 milligram, 3 mils, 50 milligram per mil, and the time is 20:30, Feb 7, 2021, and MHUMSN2. So now I want to take everything I need. So I've got a 3 ml Lurlock syringe here. I've got a needle that will work with Lurlock, and it's 22G by 1.5 inch. So that's suitable for the vastus lateralis, which is where I'll be giving the 3 mils of medication. And then a blend fill needle and an alcohol swab. So I'm going to wash my hands. And then I'm going to swab this for 30 seconds. And then I'm going to take out my syringe and my blend fill needle. So I pull back and I'm going to inject 3 mils of air into here. Okay, so now I take that out, and then I'm going to recap this. And then just push it up. Okay, make sure there's no air bubbles. And then I pull this down, and then unscrew this, and that goes into the sharps. And then I take my needle that I'm going to inject with, and then I just push this up till it gets to 3 mils, and I see a little bleb at the top of the needle. Okay, and then I'm going to attach my label. And then I have 3 mils. Okay. So I'm gonna do my second check. So I've got for Jake nursing, dimenhydrinate, IM, and this is a needle that's suitable for intramuscular. Oh, actually, here I'll dimenhydrinate here, dimenhydrinate, and then it says here IM as well. And it's supposed to be given 150 milligram. It says 50 milligram per mil. And there's 50 milligram per mil in here, so that should be 3 mils, and I've got 3 mils in here. And it's to be given daily at 2100, and I have the time is 2030, so I'll be giving this in the time frame. So I've got an alcohol swab and my gloves and a cotton ball. Then I take my MAR and a pen and my drug high. Hi, I'm Madeleine Hiebert. I'm going to be your student nurse today. So as I come in, I do a safety check. I'm also going to wash my hands. Can I see your wristband? So Jake nursing, January 1st, 1960, January 1st, 1960. Can you identify yourself for me, please? Thank you. And your birthday, please? Thank you. Do you have any drug allergies? Okay, on here as well, I don't have any drug allergies. I'm just going to check to make sure I have everything here. So Jake nursing, dimenhydrinate. It's intramuscular, and this is a intramuscular needle. It's 150 milligram, so I should have 3 ml. And then it's to be given daily at 2100, and the time is 2030. So I'm within the time frame. So I'm going to close the curtains. So I'm going to be giving you your dimenhydrinate injection. I'm just raising the bed. And I'm going to seat you in the supine position. So dimenhydrinate is a medication to reduce your nausea. It works by blocking or by competing for histamine at the H1 receptors, which decreases central cholinergic activity and results in a blockade of chemoreceptor trigger zone. If you experience headache or drowsiness, restlessness, just use your call bell and let us know. It's not uncommon to experience drowsiness, so I'd avoid doing anything that could be dangerous and request assistance for ambulation. And also it's best not to take this with alcohol or other CNS depressants. So before giving this medication, I'm going to take vital signs and blood pressure, and also check to see if the site indicates that I aspirate, and in this case they do. And then I'm going to wash my hands and put on my gloves, and then I'm going to landmark. So how I would landmark is I would put my palm on the greater trochanter, and then my other palm on the lateral femoral condyle, and then just close my hands like this, and then in the middle third on the lateral portion is where I'd inject, just anywhere in this third on this side. So I would then swab this site, and then I would let it dry, and then take this off. So it's just going to be a little poke there, Jake. So then I would, with my thumb, Z-track, pulling down 2.5 to 3.5 centimeters, and then resting my palm on here, I would inject at 90 degrees. And then stabilizing this, I would aspirate, so I just pull up a little bit. And I don't see any blood, so now I'm going to slowly inject. Then I'd wait a few seconds, and then take it out, and then release my Z-track after. Then I'd activate the safety on here, put it in the sharps. I would take off my gloves, clean up the garbage, wash my hands, and then I'm going to sign here the time, so 2030 MHU MSN2. And so now I'm going to come back in about an hour. If you do experience any unusual side effects, here's your call bell and just let us know. I'm going to be coming back to evaluate for the decrease of nausea and also be monitoring vital signs. So I'm going to just lower the bed now and then seat you back up. Are you in a comfortable position now? Okay, good. So then I pull up the side rails and just here's your call bell. And then I'll see you in a little bit. So then I would go take my stuff and I would document the vital signs that I took, and if there are unusual side effects, I would document those as well.